Hello everyone, welcome to CGTN's live stream. I'm reporter Liu Jiaxin coming to you live in Beijing. Here we are at 2024's Zhongguancun Forum. Well, this year's forum is not only a platform for innovation and collaboration, but also a showcase of some new initiatives and AIGC as well as some other advanced technology. So Zhongguancun, earlier known as China's Silicon Valley, is a prestigious gathering of innovators, entrepreneurs, and thought leaders from across the globe, and we are here at one of its 120 activities that's ongoing this year. So this is the exhibition area of this year's Zhongguancun Forum, with a lot of enterprises showcasing their strength and advanced technology and products. So this pavilion is about the medical equipment that's going to shape the future of our healthcare system. So as you can see, this is a surgical robot that is good at vascular treatment. And it's been on this kind of technology. The key of this kind of treatment is this very thin thread. It's been on for decades. So this thread, this wire, is not something new. But what's the revolution is this whole machine, this whole system, which works as a doctor, right? And it's not only good at treating the blood vessel related diseases, it can also treat tumors, which is quite surprising. So for more professional questions, I think I'm going to introduce you with the CEO of WeMed company, who's Yang He, Mr. Yang He. Thank you for joining us. So would you like to walk us through, what are the latest advancements of your company? What are those robots?
Okay, thanks. So it's my honor to have this time to share with all this technology with the audience. Okay, let's move to the system. So you can see this is a very big system used for the vascular disease. So usually we call this a total solution for the robot. So there are several parts. Well, first you see the movement, the gantry.
Oh, that one, yeah, the big one. Okay.
Based on the X-ray technology.
What is its job?
Usually we call it like a doctor's eyes.
Doctor's eyes.
So you can see from the images. So this is the brain. So the human, the real human, you saw all the vascular, the vessels.
Right.
Yeah. So this is like the eye. Help the doctor can see all the vessels.
Through our
right.
skeleton, through
yeah.
our skins, and see what's going on. Yeah. See what's going on inside our brain.
Yeah. What's more, actually, this is the real-time image, so it's very hard to get and process. Yeah.
So it's not just the camera. No. It's a real-time camera.
Right, it's a real-time camera, and this part usually we call it like the hand of the doctor. Why is it hand? Because usually for the ordinary the operation for this investment operation, so usually we call this the wire, like a wire, and the caster. We also put in some stent. So doctor will stand like here, using his hand to move this instrument. But you saw that there are some issues. First one is all the X-ray is coming through this part. So during the real operation, so the doctor will got lots of X-ray dose. So it's dangerous for the body.
Because humans make mistakes,
right.
And that's common. But for robot, it's more precise and safer.
Yes, you can see from here. So like all the instruments has been placed in the robot, and it is very stable, very accurate. So usually we call it the accuracy is 10 times better than the human.
The accuracy is 10 times better than human beings.
Right.
Cool.
So it makes all the operation much safer. This is we think why we pay a lot of resources to do this very creative products. Yeah.
Okay, so here here's the logic. It's pretty simple. By input this wire into our blood vessel, it can kind of seek the problematic area as well as the blockage, right? Am I correct?
Right, you're
yeah,
right.
and try to solve the problem.
Mm-hmm.
But traditionally, it needs a doctor to kind of find, so blindly, right?
Yeah.
Just to make it by a human's hand, but now a robot can replace him or her.
Usually, actually, for patients, the vessel has some problem. Usually, we call it occlusion. So it means become narrow for the vessel. So it's hard to make the air go through. So, but by using this robot, it make things easier. So the easier it make, like one time it goes through, but by hand several times twice to avoid the damage for the vessel. So,
it's really sharp. It's powerful and sharp.
Yeah.
It can even damage the vessel. It can penetrate it, or it can damage to the normal tissue or some other surrounding area.
Yeah, it's very dangerous. Actually, it's very dangerous.
Because our human body is fragile.
You're right.
Especially during an operation.
Especially the patients here, all the patients here, their vessels are already very not that good. So usually, because we are facing a problem that all the population are aging. This is our issue, right? So usually we call it like a vessels in the body, like water pipes in the house. If the house old enough, sometimes the pipe will have some problem. So it's normal. So there will be lots of patients need this kind of method treatment. So the requirement will be huge. Yeah.
So how cost effective is this kind of treatment? Like if a patient is going to get this operation by a robot, how much will he or she pay?
Oh, it's a good question. Good question. So first of all, for this new kind of technology, the purpose is not we want to make some money saved, not increase the money spent. But sometimes, for sure, some technology, because it's new, need some extra operation. But because all this technology made by a Chinese company, so we can make it in a reasonable price. Secondary is this robot. The first purpose is safety for the patient. This is the main purpose. The second is it can also protective for the doctor, like all the X-ray comes through. Yeah.
Right. And the doctor can control the whole system from maybe an remotely in another room.
So what's more, actually we are doing a test for a different province. Like one doctor in Beijing and the patient in another province. It's doable. We will try the test this year. It's really.
It's this year's big goal, right?
Yeah, it's big goal.
Okay. Is this already applied to the real hospitals so far?
Some parts are already in the hospital, like we call it doctor's eyes. That kind of machine already installed in the hospital. For this part, we will because in our industry we need the certification. It's highly dangerous. So we will get the certification this year. And what's more, for our company, we call it in China, we call it like some pass for the company who doing some real innovation products. They can give you a short pass. So like the whole certification can make short. So we very confident that this part will go to the hospital this year.
Yeah. That's pretty cool. Yeah. Okay, we look forward to let this whole system benefit more patients.
Okay, thanks.
Thank you. Okay. That's very cool. See you. Thank you, Mr. Yang. Okay. All right, let's go.